Great. Okay, so then let's dive into today's agenda. So we had 37 people register, so hopefully more people start trickling in. I think most of us know one another. My name's Robin. I'm the Policy and Advocacy Manager at Results Canada, but have been supporting the Stop TB Canada network as a secretariat for the last little while. We are going to get to a roundtable of introductions of everyone here with some sharing of information attached to it to feed two birds with one scone, so to speak. That's what we say at Results Canada, vegan friendly. But first, I just wanted to start with a little bit of an overview of the purpose of these meetings. So these are national Stop TB Canada calls. They're meant to be an informal space that brings together people committed to ending TB both at home and abroad to get a bit of an update as to what the Stop TB Canada Secretariat and Steering Committee is working on, and understand how you can engage more in our collaborative mission of ending tuberculosis. And then to share information with one another so we can identify ways to coordinate and collaborate. So these do happen and will be happening every 2 months. They used to take place on like a dial-in phone. Dr. Dina Fisher had sent out like a standing meeting invite with call-in details. Those call-in details do not work anymore. I've tested them. So if you still have those invites in your calendar, just remove them. And from now on, it'll be more of a register for the national call process in a Zoom link that you get access to, okay? So today, we are going to hear some updates from Stop TB Canada. And then we're going to do a roundtable of introductions and have you share information about what you might be working on right now or what you have planned for World TB Day. And then you'll hear from the Secretariat again about some of the things we're doing around World TB Day this year that you might want to participate in as well. And we'll share information as to how you can go about doing that. Okay, so first up, some updates from the Steering Committee and Secretariat. So 2020 was really the year of reinvigorating the network. That's how I see it in my mind. We spent a lot of time and energy getting the website up and running again, getting Twitter up and running again, engaging a steering committee so we could get a steering committee on board, really laying the foundations to kick off this year of 2021 to build. So just to say, we do now have a steering committee in place. We've got the website, we've got a Twitter account. We're doing these bi-monthly national calls. You can expect to see a quarterly newsletter from us as well, and a webinar, as well as more opportunities to engage as they present. Really, we want this to be a space for the community to engage. So if there's something you ever want to lead on or bring to the table, please do so, and we can jump in and support however makes sense. We're also here to support your work. So if there's anything you ever want amplified, just send it to us and we can make sure that happens. Or if you want to coordinate on an event or activity, we can also look to make that happen. So this year, the year of building and laying solid foundations, we're really aiming to build out what a work plan for the steering committee could look like on an annual rolling basis, so that we can start looking for some resources, for example, to sustain the network. Right now, it really is volunteer run and led through a number of us who are giving time off the side of our desks, or resources coming from our individual organizations. But we'd like to turn this into a sustainable network that can function in its own right. So right now we have 2 subgroups formed within the steering committee, one that's working on building out a solid governance structure for the network, and another that's working on building out that work plan and a budget to go alongside it. Couple things I just wanted to share with you now. Maybe Lee, you can throw it in the chat box, but we do have a bit of a mission, vision, how we work, and about us statement now up on our website. This is a work in progress, as is absolutely everything we do. So it is open for discussion, and we'd love to hear feedback from all of you on it if you have any ideas as to where we should be taking the network moving forward. The reason we're building it is there's there's been a bit of a gap in terms of community representation in Canada, engaging in a sustainable and coordinated function in the national level, but then also within global policy fora where some of us engage to NTB. Thanks, Lee, for sharing that link. Let us know what you think. I also wanted to say that the year of building, we really want to prioritize building out our directory and getting to know who all the different actors in Canada's ecosystem working towards ending TB are. So if you haven't yet done so, if you could take 5 minutes to fill out the form through the link Lee just shared to join our directory, it would be really, really helpful. We're building out directory pages on the website, and then we're also going to use that information to start sharing information about who's doing what in TB in Canada, and also to be able to reach out to you as and when speaking opportunities might present themselves. So if you tick the box of like, yes, you can approve me for speaking or media engagements, then we can start reaching out to you and engaging you so that your voice is heard in different platforms where we might gain access to. Okay, and then last thing I wanted to share on an update is if there's any support you can offer to the network, we'd appreciate it. We are, as I said, a volunteer community right now, but if there's something that you want to bring to the table or can bring to the table, and you're willing to engage and be an active member of this community, like please reach out to us, and we can figure out how to make that happen. So our email, I'm just going to put in the chat box right now. Anytime you can reach out. Okay, so let's move into, unless there's any questions on anything, I think we can move into our discussion, our roundtable discussion. Any questions first though, or thoughts, comments on the direction we're moving in? Nope. Okay, great, roundtable. So we're going to play Pass the Baton, and when we do this, essentially what happens is everybody's going to take the opportunity to introduce themselves, who they are, about them, and then also share some information about any critical projects you're currently working on that you want to raise to the awareness of others, and any plans that you might have coming up for World TB Day. And if you have plans for World TB Day within your respective organizations, and there's any links to more information that you can share in the chat box, please do so, because we plan to collate all of the Canadian-based World TB Day events taking place and send out a newsletter with a list of all that information so that we can amplify all of the great work that you're doing. Okay, so I'm going to, so pass the baton means you go, and then when you're done, you pass the baton to someone else. So say, okay, I'm going to pass the baton right now to Petra.
All right. So hello, everyone. I think I know many of you, but some I don't. My name is Petra Heitkamp, and I work for the TB PPM Learning Network, and PPM stands for Private Sector Private Provider Engagement. So PPM is public-private mix, with the idea that in many of the countries that we work in, and especially the highest TB burden countries, there are really large private sectors where people seek care. And we need to do a better job of engaging those private sectors, whether they're informal drugstores, pharmacies, or large private hospitals. Often they do not have the tests or the diagnostics or the drugs or the availability to any information that the National TB Program has. So that's the aim of our learning network. So I work mostly internationally, but I'm very keen to ensure, being based within McGill as sort of a housing agency, that we're also making connections and linking in what's happening within Canada. And I see a huge advantage of actually cross-learning between what domestic Canada activities are. Often there are clear parallels what's happening in the northern provinces and territories and many of the areas that we work. So there is some huge opportunity to really collaborate more. So that's a little bit of an introduction and a reason on why I'm keen on being involved and helping amplify the Stop TB Canada in any way we can. our work right now, we have been doing quite a lot of work on the impact of COVID, and we're doing currently some assessment work on looking at how private providers in India and in some other countries are impacted by the COVID epidemic, and how the healthcare seeking behaviors have changed within those countries. So we're doing, we're coming out in the upcoming month with some webinars where we bring together the larger organizations in India, Pakistan, Bangladesh, Indonesia, Nigeria. So the big seven that have the highest private sector and the highest TB burden. We're bringing together the implementing NGOs that are sort of intermediary agencies working with many of the private sector platforms. And so our World TB Day angle is around that, where we're doing a series of webinars, bringing those different groups together and highlighting the impact of COVID on the private sector within the high burden countries. And I think I'll put a little pause here. I'm happy to further creatively support the Canada agenda. I will pick up my responsibilities in writing to any PMs, or I'm happy to support further conversation. And thanks for Stop TB Canada for pulling the letter to the minister together. I think that was a really good first advocacy move to highlight the importance and sets kind of the bar a little bit of where we want to go with what messaging towards World TB Day. So I think you've laid a really nice launch path for our World TB Day activities. And so any way that we can help in that regard, I will happily do so. And I'm passing the baton to someone that I don't know. Let's see, Camilla.
Hi, everyone. I apologize for being rude and leaving my camera off, but as with most technology, it's just currently decided it's not going to work right now. So unfortunately, I can't turn it on. So my name is Camilla, and I'm a researcher based out of Provincial TB Services at the BC Centre for Disease Control, and I'm a PhD student at UBC. The primary focus of my PhD is to gain a better understanding of post-TB morbidity and to identify intervention points to help mitigate it, whether that be referring TB survivors for spirometry, providing more education on post-TB health. So just kind of intervention points. And for now, that research is primarily based in BC. For this work, I think it's incredibly important to engage with TB survivors, advocates, and community members. And I thought that this would be a really good place to start those conversations and that engagement. So I'm going to pass the baton to Adam.
Oh, hey. So you're catching me in the kitchen here. Sorry, I just got on the call. Sorry. That's just introduction.
Yeah, we're doing intro, who you are, what you're currently working on that you might want to raise to the awareness of the wider TB community, and if you have any World TBD plans to share that we can all support amplifying.
Right. Okay. Hi. I'm Adam Houston. Most of what I'm working on right now is access to medicines, which is getting a little derailed by COVID access to things. But yeah, that is the main thing that I'm looking at with TB right now is fitting TB and access to medicines into the broader conversation, particularly around COVID right now, and the TRIPS waiver and so on. So yeah, I think that just fits into the conversation and just is a reminder that, hey, we're having this big conversation about COVID. A lot of these conversations have been going on for a long time around TB. We shouldn't be forgetting about these issues as we're talking about equitable access to treatment and so forth.
Are you doing anything for World TB Day? Might you want to write an op-ed or something? No pressure.
I am. The op-ed idea, Courtney had mentioned that to me as well. It's on my radar. And it's on my list to follow up with you, Robin, about the very good op-ed that was shared with me already. That was quite, yeah, no, if that had been placed and then try and coordinate on that a bit, so we're not duplicating, we're complementing.
Perfect.
And I don't know who has been called upon already. If Ben has not, I'm going to continue that particular trend.
Hey everybody, how are you? Thank you, Adam. Thank you, Robin, for organizing and hosting. So my name is Ben Gebo. I'm a graduate student at the McGill School of Social Work, and first start out with a land acknowledgement that I acknowledge that McGill is on unceded territory from the Mohawk and Ganegaha communities, also many of the other nations of Quebec who would go through there to trade and to kind of, live and be working on a paper with Trevor Stratton to present to the United Nations for their big Indigenous Peoples Forum this summer. They're doing kind of a strategy and action plan for ethnicity and health position paper where we're trying to get the UN permanent forum to really focus on TB as well as HIV, STDs, viral hepatitis. So it's a very important part there. And I've been working kind of just in dialoguing with McGill physicians and community health workers and Indigenous community advocates in Montreal area about, the need for intervention, information, and community response. So if you have any literature, I'd love to get any articles that we might incorporate. We're going to try to get funding to do like a 20-page policy brief, and then we present that at the UN and, try to give like a synopsis of needs. They have 5 priority areas: production of evidence, promotion of policy, social participation, strategic partnerships, recognition of ancestral knowledge and traditional and complementary medicine. And then they have, kind of an international Indigenous approach about that. So it's, kind of a big project, but I did a paper on international development in Indigenous communities and also one on reconciliation and how it started with the South African Truth and Reconciliation Commission. So it's going to probably feel like that, but we're going to be hopefully ready, and if you have any also ideas of what to include in the outline, we have kind of a structure, but of course, who knows, maybe we don't think of something, we're not exposed to something. So any recommendations are helpful. Thank you. And I pass to Amal. Hey, Amal.
Okay, hi everyone. My name is Amal. I'm an undergrad student at York University in studying global health. And I've also am an intern with Results Canada, and I've joined to support the Stop TB Canada. In terms of events for World TB Day, I'm going to be organizing a Yorkie webinar about how COVID-19 has impacted TB and TB services. And it'll just be a discussion panel to understand how the health services have been impacted and future steps that we can take. I'll also share the registration link in the chat box for anyone who's interested. And yeah, that's all from me. If anyone has any questions, just let me know, and I'll pass the baton to Lena.
Hi everyone, my name's Lena and I'm a PhD student working on TB with Dr. Madhu Pai at the McGill TB Center. And for World TB Day, we're collaborating with the McGill TB Center to have a World TB Day Research Day event in collaboration with Stop TB Canada. And we're also working on a survey to look at the impact of COVID-19 on TB programs in Canada. So that's in the works as well. And yeah, that's all of my updates. I'm going to pass the baton to Courtney.
Thanks so much, and hi to all. I'm calling in from Treaty 6 territory, from Edmonton. It's traditional homelands of Métis and a welcoming place to all contemporarily. I work as the manager of the Tuberculosis Program Evaluation and Research Unit at the University of Alberta. And recently we've been trying to legitimize ourselves as a research group with something to say. So we've been kind of spamming social media platforms with a communication strategy under the header TB in Focus. So we have a website, tbinfocus.ca, a Twitter, an Instagram, a Facebook. You may see us on there trying to collate research and documents from across Canada that touch on the issues related to TB in Canada. With respect to World TB Day in 2018, I wrote a commentary in the Canadian Journal of Public Health about a lack of surveillance data that kind of handcuffs us and our ability to take action. So today I submitted a follow-up commentary about the lack of surveillance data in Canada that is handcuffing our ability to take action. And I'm hopeful that it could be published in time for World TB Day, but if not, I think I would share it with the group and see if there's any interest in getting it out as an op-ed, because the issue is very urgently in need of being addressed. I've been working on also quantifying COVID disruptions to essential TB services, and Lena has really been helping out with that. I have been working in a subcommittee here with the Stop TB group to try and find funding to operationalize sort of the mission and tasks associated with the group, and looking specifically at policy documents in Canada to see what commitments have been made, and looking to see what kind of governmental or arm's length agencies we could tap into for funding to meet their own commitments, and see if we can develop partnerships that way. I took the letter to the MP template and sent it to my MP with no response, unsurprisingly, so far. And in the next edition of the Canadian TB standards, there is a new chapter on the importance of surveillance and program performance indicators to achieving elimination, and I will be a lead author on that. So all of these conversations, I think, are important to Stop TB Canada, and from Stop TB Canada to informing my own research, and that's why I'm here. And I would pass the baton on to Adam G, if he's still on the line. Maybe he's not.
Well, Adam, can you hear us? No? You're up. I'll message you and let you know what's happening. Maybe we can go to Tina then next while Adam's getting his mic.
Hi, sorry.
Oh, you're here. Yeah.
Yeah, sorry about that. It was like at that moment, I think that the baton was being passed. My connection just went by the wayside. So sorry about that. It was like the worst possible timing. But just to say hello and thank you for, thanks to everyone for joining today. It's nice to kind of get together and hear where people are coming from in terms of their work, kind of as a group together. So thanks. I'm really happy to have this opportunity. My name is Adam. I work mostly on the kind of global side, but in terms of the sort of the specifics of that work, I work for an organization called Plan International. Previous to that work, I was working with Partners in Health, which has done sort of a lot of historical work in various parts of the world, but in particular starting in Haiti and then West Africa, as well as East Africa. So the focus of my work is primarily I'm very much a generalist, and I provide accompaniment and support to my colleagues who are doing a lot of the really heavy lifting, mostly in West Africa, in Nigeria, and also Liberia. So in particular, we work with projects that are financed by both the Stop TB partnership through the TB Reach facility, so specifically Wave 7 funding for anyone who is sort of into that area around TB case finding at the community level, sort of married with activities around gender equality and women's empowerment. And that's specifically looking at Sokoto State, which is in northwestern Nigeria, and 9 local government areas within that part of the country. So it's really focusing on kind of women's empowerment activities, challenging sort of traditional notions of masculinity when it comes to health-seeking behavior for women who are living in the community, and then working and compensating women who are at the community level to engage in active case finding activities, basically household visits, to detect cases, TB cases from the outset, and then also to help to increase the capacity of that whole TB care cascade, to make sure that a diagnosis is made, and then after treatment is followed up on, and so on and so forth. So it's kind of increasing the linkages between the formal health system and the community level. And then a very similar project in Liberia, and that one is financed by the Global Fund in 4 counties in Liberia. So in terms of World TB Day, so from within my organization, what we've been doing is just to sort of organize within my own team to do a lot of internal learning opportunities, sort of mostly related to, in an organization like Plan International, it's highly sort of multi-sectoral in terms of the work that it does. And so it's often hard to try to say isolate one particular sector and bring that to the forefront within the organization. But we push really hard to do that, and we're pushing really hard to do that within Plan International to kind of bring that, to socialize the work that we're doing and the importance of the work that we're doing on TB. This year, we're sort of looking at a couple of things sort of in line with Stop TB Canada, and that's to kind of increase the volume a little bit on the connection, the sort of local global connection. So for example, looking at TB in Canada, getting into some of the important issues, for example, around decolonization of global health, and then kind of raising the profile of what does sort of decolonizing health look like in Canada as well, in particular with Indigenous communities in Canada. And so trying to make those connections within the work that we do in Plan, and then also kind of from a global perspective as well. So thanks very much.
All right, I'll pass the baton for you. Linda. I don't think Linda's gone yet.
Hello, I'm a federal public servant with the Public Health Agency of Canada. It's always very interesting for me to hear about the work of civil society organizations and the important work that researchers are doing in the fight against TB. We follow developments. We're always interested in hearing about your activities. For World TB Day, We haven't started on our plans yet. They're just currently under development, but normally we do acknowledge the day, and the hope is that we will do the same this year, even during these COVID times. Thank you.
All right, then I'm going to pass over to Kylie for the GAC perspective.
Hello, everyone. Hello, colleagues. This is my first time participating in this national call, I think. But yeah, so my name is Kylie, and I am a Senior Development Officer responsible for our global TB policies and programming at Global Affairs Canada. Very nice to meet you all. So right now, I am working with our colleagues to determine our new budget resources for the upcoming fiscal year, which would affect our funding to global TB programs, especially the TB Reach initiative at the Stop TB Partnership. So basically, our funding to TB Reach is coming to an end on March 31st, 2021, so next month. But at the moment, we are not able to confirm or sign any new grant agreements with any organizations because of the financial situation. So yeah, so just working with colleagues to kind of like finalize, determine what's going to happen. But we are working hard to make sure that TB will not fall behind, will not become as a neglected diseases, and especially as we are coming out of this pandemic. And for World TB Day, since we are not announcing any new funding, I think we're going to keep a low-key approach, but there will be social media posts coming out of World TB Day. So yeah, thanks. I don't know who hasn't gone yet. Oh, yeah.
Lee.
Yeah.
Hi, everyone. My name is Lee. I was actually just brought on to the Results Canada team this week as a policy and advocacy officer, where my main focus will be on the tuberculosis work. So in this role, I'll be engaging continuously with the Stop TB network. In terms of World TB Day, with support from our volunteers around the country, as well as Stop TB Canada, we will be lighting up monuments in red nationally to increase awareness of TB and to stand in solidarity with all of those affected by TB. So we're going to be tracking and promoting these monuments that are going to be lit up throughout the month of March. So I'm going to share a link to a list of these monuments where you can also let us know if you're requesting a local landmark to be lit up in red. So I'll just add that to the chat right now. So yeah, I think that's going to be a really powerful initiative to raise awareness. So definitely the more the merrier. And in addition to this campaign, we at Results Canada are continuing to support all of the work of Stop TB Canada, which Robin is going to touch on a bit more shortly. And finally, we are coordinating a high-level event in partnership with partners in Health Canada and Stop TB Canada, which will be held on the evening of March 23rd. So we're really excited to have Dr. Joya Mukherjee secured as our global speaker. And I'll just pass that over to Robin if she has anything else to add in regards to that event.
Holy wow. I'm like, you know our work inside and out in a week. Such a good hire. So happy to have you. Yeah, so we are looking for a domestic speaker for this high-level event still, and I thought it could be good to try and tap the Stop TB Canada network. We do want to be bridging the connection between the global to local experiences. So if anybody has any suggestions or ideas of who might want to participate in an event like this, it's going to be a town hall discussion-based event. Our volunteers are being asked to watch Bending the Arc before the event, so they will come having seen that video, and then there'll obviously be a bit of a discussion around that to see their reactions, and then some pre-planned questions for our two panelists, followed by Q&A from the audience. Obviously, we're going to close with strong calls to action supporting the domestic Stop TB Canada asks we have out and the global ones that we'll get to in a minute whenever I share that information with all of you. And I also just wanted to flag that in terms of the monuments, this is the most, this year we've had way more monuments than any other year. So we are going to also be trying to land a paid media thank you to everybody who took part in trying to get a landmark lit up and who was standing in solidarity with people affected by TB in the Hill Times, just to show our MPs that like your constituents do really care about this. So stay tuned for that. And then who's not gone? Tina, I haven't heard from you yet, I don't think. And then I think everybody else is gone, right?
Hey everybody, it's so nice to see familiar faces. I apologize, I don't have my camera on. I'm not in the best shape this morning, but it's good to hear updates from everybody. My name is Tina Campbell. I am a TB advisor at Northern Intertribal Health Authority in Northern Saskatchewan. So for our region, for World TB Day, our plans for our organization specifically, there was a TB talks for 4 podcast sessions. I think it was season 2 released by NCCID. They're amazing podcasts. If anybody is able to take a listen to them, you should. It has TB survivors interviewed, talks about stigma, and you can really tell that, you know, TB care is really a collaborative effort between multiple team players. And also on reserve communities in Northern Saskatchewan, we have TB program workers, and they're such a big part of the TB care that people receive. And it's like raw emotion. I just love it, and I can't wait to present it to the rest of our staff on World TB Day. We're going to do a lunch and listen and provide some lunch for them on World TB Day. So we look forward to that. I'm in partnership with Indigenous Services Canada, and we're organizing a TB workshop for next month. It's going to be over the span of 4 weeks, some presentations from TB experts from across Saskatchewan. And it's virtual, so everything's virtual this year. So we'll see how that goes. Hopefully we'll have good, what is the word I'm looking for? People will attend, just because COVID is still really high in all of our communities. So the nurses are quite busy, but we'll see how that goes anyways. So I am also revamping all our TB resources for our website. The last time they were done was in 2017. And then also creating a COVID versus TB resource. We have had more than usual TB cases pop up in the past little while, and they've all been kind of people who are really sick. So I think COVID and everything is really delaying people's want to reach out for health care. So that's kind of scary for us. We don't want some huge outbreak to happen. So we're trying to work together with our partners to try and prevent that from happening. So hoping the resources being available will put more TB information out there. The letter for the MP, I also want to send that out, but I haven't been working all week. I've had no childcare, so my son's had no school, so I've been at home. But yeah, that's all the updates I have right now. Again, it's nice to see everybody.
Thanks so much, Tina. And Cynthia, have you gone yet?
Hi. No, thank you. Thank you, Tina. So I'd like to just start by acknowledging the unceded Algonquin Anishinaabe territory from which I'm joining you from, and I'm very privileged to live, work, and play here. So I'm Cynthia. I work for Indigenous Services Canada. I'm a nurse advisor, and I've been with the department for just over a year now. For World TB Day, we have a few things planned. We're organizing a webinar on TB stigma for the nurses working in First Nations and Inuit communities across Canada. It's a long-standing issue, creating barriers to testing and treatment, as you all well know, and it's likely been amplified now with COVID-19. So we're hoping this webinar will give nurses some tools in the face of stigma. So we're very lucky to have TB expert and Stop TB Canada Chair Elizabeth Ray as our key presenter, which is just amazing. We're just so over the moon happy that she's committed to her time to this. And we'll also have presentations from a nurse that Tina, thank you, put me in connection with. She's a TB nurse working for the Northern Intertribunal Health Authority in Saskatchewan. And we will also have a wellness worker, DOT worker, and TB survivor joining from BC. She works for FNHA. So really excited that everyone can bring in their experience and into this discussion. So other than this amazing webinar, I mean, I'm just really excited for it. And that will be recorded and distributed to nurses who can't attend, because of course our nurses are all very, very busy working and responding to the pandemic. So we will be making it available at a later time for them as well. We've also developed a TB 101 PowerPoint presentation for health workers, whether it's TB champions or public health nurses, to use in educating the public or school workshops. So we have that as well that will be distributed. And I just want to say thank you, Robin, for organizing this. It's been so great hearing about everyone's work and projects, and well, thank you everyone for your hard work.
Awesome. And I think that is pass the baton done, which is perfect timing. So I was like up till 1:45, and that gives time to kind of pull some threads together from some of the different work. So I just wanted to take an opportunity to share some more work that Stop TB Canada has been working on that you might want to get involved in. Before I do so, I just wanted to maybe touch a little bit on a couple of things I heard where people could connect with one another. So I hope that this type of information sharing is helpful. If you ever hear from somebody about a project that sounds interesting, that you want to learn more about, or maybe there's a potential for collaboration, I do encourage you to reach out to one another. You can message everyone in the chat, or you can private message individuals. So exchange emails and make those connections and sharing of resources happen where you want to. Off the top of my head, I'm just thinking, and I'll get to it in a minute, but there is an opportunity, I think, Ben, for you and Trevor to really feed in some policy content into a draft letter to the Minister of International Development that we have ready to go. So if you could feed into that, that'd be really helpful. And it's a space to do that with the work you talked about working on right now. Adam Houston, I'm thinking maybe you and Courtney, depending on how her commentary goes, there might be space to pen an op-ed with a domestic focused ask that kind of pulls from the messaging that's in the letter to the Minister of Health already, and kind of amplifies the fact that we've done that, we've sent that, it's in her hands, and this is what we want to see happen. That's just an idea. And then Tina, I'm not sure if you're interested, but I feel like for this high level event I mentioned, if I could send you the run of show, if you think there might be somebody within your network that would be available and interested in speaking, we could maybe collaborate on that. Okay, so let's just dive into some World TB Day plans for Stop TB Canada. So steering committee's up and running, great, yay. We are working hard with the support of Lena and Alex and Amal, Lee, myself, others. We're working really hard to mobilize the steering committee to take action. A number of you are on now, and we really had a successful first collaborative take action piece of work recently. We drafted a letter to the Minister of Health, so Minister Patty Hadju, and we sent it to her last week. I'm going to, or Lee, maybe you can share the link to the letter in the chat so that everybody can take a look at it. Right now, the main asks within that are getting up-to-date epidemiological data on TB in Canada, and then wanting to follow up on a statement that the Public Health Agency of Canada put out in July about making sure that TB is addressed alongside the COVID-19 response as and where it makes sense, because investments and tools for COVID-19 can be leveraged to improve the TB response. So take a look at that. That's in Minister Hadju's inbox right now. We're hoping to secure a meeting with her to talk about the contents of that letter. And just to say that we try to create space so that if that meeting comes to fruition, we can put more on the table than what's in that letter right now. And it would be cool to see if other people, a wider group of the membership, would want to participate in that meeting if we land it. So stay tuned. If we land it, we'll reach out and try and get you to engage. Petra.
I'm just wondering whether it's an opportunity to invite her to speak at the high-level event, which would give her a platform to respond to a larger public than or address some of the issues that is in Public Health Canada's mind, and the minister can maybe be briefed by PHAC or by GAC or by Indigenous Affairs, and maybe some of the colleagues on the line can help craft a message for the health minister so that she addresses TB jointly on behalf of some of the government programs all concerned about tuberculosis, and that she gets a 15-minute spot in the same panel where you have Joya Mukherjee, and really that is a large, where you will probably have a large group of an audience. That might be something to offer for her, which might be more interesting than an individual meeting.
Yeah, definitely. It would be, to do that, it would be also cool to have Minister Karina Gould there, speaking from the development perspective. Like, I think that's a great idea. And I think we should aim high. I'm not sure if we'd secure her, but maybe she'd prefer to do something like that rather than a roundtable discussion with members. Maybe that's a better option for her. So hopefully we just hear back from their office, and then we can start negotiating or discussing like how can we engage her on this issue best. But I love that idea. If we can make that happen, that would be phenomenal. So yes, noted.
I'm just wondering, just to jump in, because I think it's great to see that Linda and Kylie and are on the line, and Cynthia too, because you have more direct insight into how we could maybe work those communication channels, or maybe you know someone who would help us pass the letter on or a request on to someone that works more directly in their offices. So taking the opportunity of addressing some of the people that I didn't know before, but I'm really excited to see that you're joining the call.
I would say you've taken the correct approach in writing to Minister Hadju directly. She wants to hear from civil society. She wants to hear from Canadians. She wants to know what the issues are. So I think you've really taken the right approach, and I look forward to seeing the results.
We've got a parliamentarian team at Results Canada too, so we can we can push hard on that within our networks and experience, Petra, unless others have networks or contacts with those two offices that could give us more streamlined access.
No, I don't think so. I mean, I don't have direct access to the minister's office, so I think you're doing, you're going through the proper channels.
Okay, but yeah, Petra, I like that. Let's try and make that happen as like our shoot for the moon thing. Okay, the other thing is, okay, so we got the letter to the Minister of Health out the door. It's in her inbox. Now we have a draft letter to Minister Karina Gould ready to go as well. It's with the steering committee for feedback and comment, but of course open to others feeding into that. Although my civil servants on the call, you probably shouldn't feed into it, but happy for you to be aware that it's happening. So the letter to Minister Gould right now, as it stands, it really calls attention to the need to maintain, if not enhance, Canada's position of leadership in the global TB response during COVID-19. We know that TB Reach is sunsetting and funding in March, and it would be absolutely devastating to people affected by TB in the hardest to reach communities if Canada did not maintain its historical investment in TB Reach, when we know that services are being critically diverted. Like, TB Reach is really well placed to fill gaps in service provision. So Results Canada is going to be campaigning really hard for maintenance investment in TB Reach. And it's in that letter to the minister right now, as is an ask for into the longer term, Canada to step up its investment in TB R&D. We are just $6 million USD short of reaching our fair share target on an annual basis. So getting to that fair share target would obviously be awesome. And also then an ask around the Global Fund COVID-19 response mechanism, wanting to see Canada maintain strong leadership in the Global Fund. But I think personally right now, the letter is lacking some strong policy recommendations. Those are all very like monetary related asks. So if we can pull in some policy asks as a group, that would be awesome. And I'm looking to Ben, Petra, Adam, G right now to maybe help do that. So the draft letter is there. We want to get this sent to Karina Gould by mid next week. And in it, I'll add a meeting with us and or like 10-minute slot to address people at our high level event. Okay, and then the last thing is that we'd also like to try and get as many meetings with members of parliament as possible, or at least try to get some meetings this World TB Day, and which would bring us together to work collaboratively around our domestic and our global asks, and would start building our I guess, recognition on the Hill and with parliamentarians as a network of Canadians that care about ending TB at home and abroad existing. So we have a draft letter for everybody to send to their member of parliament. All you need to do is tailor it to say who you are, send it to your MP, request a meeting, and we'll try and get a couple of MP meetings in the books around World TB Day as well. And we will extend the invitation to the wider Stop TB Canada network to participate in those meetings. So if you help us land some meetings, of course you would participate in that meeting, but we're also going to try and have like probably 3 people in a room with an MP at a time. We can all invite our wider networks if we want to. So throwing that out there as an option. And I think that's everything I had on my agenda to share with you all. Any questions, comments, concerns, please let me know. All of this is always a work in progress. All of this only works if we all engage. We are trying right now to build an effective, coordinated community of Canadians that care about ending TB at home and abroad. So the more engagement we get from you, the better. And we have human resource ready to engage in this space. So reach out, send us any information that we can amplify. If you want to coordinate or collaborate with others, maybe we can help make connections that make sense. If you have any support to bring to the table, offer it. We'll take anything we can get. And yeah, I'll leave it at that. That's all from me. So if you can, your action to take away today is to email your member of parliament, telling them why you care about ending TB at home and abroad, and asking for a meeting around World TB Day. And there's a link in the chat right there with a beautifully drafted letter that all you need to do is slightly tweak and send to your member of parliament to make that happen, and CC us in, of course, so that we can help coordinate the admin side of things. Okay. Any feedback on any of that?
Right, so my connection is a little unstable, but can you give me more information on that high level event? Because my internet keeps going on and off, and I just missed a few information on that. Thank you.
Yeah, sure, Kylie, if you want, because we're meeting this afternoon, I can walk you through it in more detail.
Yeah. Okay, sounds good.
Okay, perfect. Go ahead, Petra. Just jump in.
First of all, I think it's really exciting the World TB Day sounds like a really great opportunity for things to come together in terms of more of a policy angle and highlighting. And I think it's really cool to see how the different perspectives from the Stop TB Canada are even talked about today. And in that regard, I know that in the steering committee, we have been discussing that maybe one of the priorities for this year could be to really look at helping build a network of TB survivors. And I just thought, since I heard Camilla talk about it and Tina mentioned it and a few others refer to it, I just wanted to highlight that as something. Adam, are you signing at me? Or no, you're just putting your hand up. Okay, I thought that this would be maybe something that you would be interested to hearing, and that we don't know how yet or in what shape, way, or form, but in the upcoming months, that is one of the priorities that we're really looking at, pulling together a forum, maybe in the first step of TB survivors. So I would encourage people like Camilla, and obviously Tina is already involved, to maybe keep your ears open and jump in and volunteer if you have thoughts in that regard, because I think it would be really cool to work on that together.
Right now, that piece of work is being led by Priya Amin, who's on our steering committee, and she is a TB survivor based in Toronto. I mean, our approach, like where we are at now, is we've got a flyer ready to go to like put up in clinics to try and start connecting people. We've got a few different pieces and like they're ready to start trying to engage the wider community. But yeah, I think it would be really helpful to have others that have relationships already with those communities work alongside Priya to make that happen. She's really determined to make it happen. So giving as much support as possible would be helpful.
Petra, that's a great idea. And Robin, thank you for the information about Priya. If I send an email to hello@Stop TB Canada, would you be able to connect me and Priya if possible? Awesome. Thank you so much.
Camilla, I also noted that you might want to get involved in the data collection and survey project that Courtney and Lena are working on, just as an FYI. So if that's of interest too, we can loop you into that.
Awesome, thank you.
Okay, everyone, that is time. That is time. Thank you so much for showing up and participating. We will see you all online, Twitter, email, and hopefully at the next national call. Good luck with World TB Day. Let's make a real big splash and raise awareness about the importance of ending both TB and COVID-19.